Welcome to another video of Food Nourish Deep Dives, the videocast of foodnourish.net, where we explore topics like health, food, supplements, and alternative approaches to health and wellness. Today, we're getting into a really practical, proactive plan for dealing with respiratory infections. We're going to move way beyond that old advice of just, waiting it out.
Oh yeah, we've all been there, right? That awful feeling when a cold or flu starts to creep in, the stuffy nose, the sore throat, that cough that just seems to hang on forever. It feels like it's never gonna end. And on average, adults get hit with this stuff 2 or 3 times a year. The standard advice is always the same. Just rest and drink fluids. But what if there was more you could do? What if you could actively fight back instead of just passively waiting for the misery to pass?
So, here's our game plan for this explainer. We're going to walk you through a whole roadmap. We'll kick things off by looking at the problem differently. Then we'll introduce this proactive 3-pillar plan. We'll cover internal support, how to actually clear out all that congestion, some really common mistakes you want to avoid, and we'll wrap it up with an action plan you can use the second you start feeling sick.
All right, let's talk about this big shift in mindset. Instead of just laying there and hoping your body figures it out, this whole approach is about active support. We're talking about a real, structured protocol that's designed to do 3 things: reduce the viral load, thin out all that nasty mucus, and manage the inflammation, all so you can get better, faster.
This slide just lays it out perfectly, doesn't it? On the left, that's the advice we've all heard our entire lives. Just wait. But on the right, that's the active approach, a solid 3-pillar protocol that actually empowers you to support your body's healing process directly. And that's the key idea here. You have way more control in your recovery than you probably think. Let's dive into our first and honestly most foundational pillar, internal support. This is all about giving your body the specific ammunition it needs to fight the infection from the inside out. We're talking about disrupting how the virus copies itself and calming down that out-of-control inflammation.
And first up in our toolkit is zinc. You should really think of it as the gatekeeper. See, zinc ions literally get in the way of how viruses multiply. But here's the trick. The delivery method is everything. Using a lozenge dissolves that zinc right in your throat and nasal passages, which is the exact battleground where the virus is trying to set up camp. If you just swallow a pill, it completely bypasses this critical area.
And the science on this is just wow. A big meta-analysis of a bunch of trials found that by day 5 of being sick, a whopping 70% of people using zinc lozenges were fully recovered. Now, compare that to only 27% of the people taking a placebo. That is a huge difference. We're not talking about a small boost here. This is a total game changer.
So, what does this actually look like day to day? Well, for zinc, you're aiming for about 80 to 92 milligrams of elemental zinc per day, spread out from those lozenges. Then you bring in the power couple, quercetin and vitamin C. Quercetin basically acts like a shuttle, helping to push zinc into your cells where it can work. And vitamin C? It recharges the quercetin so it can keep doing its job. And finally, you've got vitamin D3, which helps your immune system mount a response that's strong but not out of control.
Now, if you're thinking about stocking up on some of these key supplements so you're ready, we've actually put together a resource for you. If you head over to foodnourish.net/deals, you'll find a whole bunch of deals on wellness and supplement brands. We're talking major brands like Perpetual Life, iHerb, Source Naturals, Nootropics Depot, BioOptimizers, and a lot more. It's a really great way to get your kit built before you actually need it. And of course, you can get the link right in the description of this explainer.
Okay, so that internal support is absolutely crucial, but it's only one piece of the puzzle. Now we have to deal with the physical symptoms head-on with pillars 2 and 3, clearing out all that congestion. And why is this so important? Because stagnant mucus is the perfect breeding ground for a secondary bacterial infection, so getting it out has to be a top priority.
So first, we can actually thin the mucus from the inside. NAC, or N-acetylcysteine, is fantastic for this. It works on a molecular level. It literally breaks the sulfur bonds that make phlegm so thick and sticky. Then you have this really interesting herb, Pelargonium pseudoides. Clinical trials have shown pretty strong evidence that it can shorten the duration of acute bronchitis by almost 2 days.
Now for the mechanical side of things, nasal irrigation. Just think of this as a viral washout. Using a salty or hypertonic saline solution does a few things all at once. It physically flushes out the germs, it thins out the mucus, and the saltiness helps pull fluid out of swollen tissues, which opens up your nasal passages.
And get this, a clinical trial found it cut the illness duration by 1.9 days, and, amazingly, it reduced transmission to other people in the house by 35%. That's incredible!
So here are 3 super simple tactics you can use for immediate relief. Number 1, that saline rinse we just talked about, 2 or 3 times a day. Number 2, steam inhalation. Just add a few drops of eucalyptus oil to some hot water and breathe it in to moisten everything up. And third, for that horrible nagging cough, just a teaspoon or 2 of dark honey before bed. You know, studies consistently show that honey is often more effective than the active ingredient in most over-the-counter cough syrups.
All right, so knowing what to do is half the battle, but knowing what not to do can save you from actually making things worse. Let's really quickly cover a couple of the most common mistakes people make when they get sick.
First up, this old myth of sweating out a fever. Your body is already losing a ton of fluid when it's fighting a fever. Trying to force more sweating can lead to really dangerous dehydration, so don't do that. Second, and this is a big one, taking antibiotics for a cold or the flu. You have to remember, antibiotics kill bacteria, not viruses. So taking them is not only useless, but it actually harms your gut microbiome, which is a massive critical part of your immune system.
Okay, so we've covered the 3 pillars, and we've covered what to avoid. Now let's pull it all together into one cohesive 24-hour action plan that you can start the moment you feel that first little tickle in your throat.
Here's how you can structure your day to get the maximum effect. It's a pretty simple rhythm, really. In the morning, you wake up, you hydrate, you take your first round of supplements, and you do a nasal rinse to just clear everything out. In the afternoon, you're going to repeat those key actions, more supplements, another rinse, and maybe a steam inhalation session. Then in the evening, you take your final supplements, use that honey for your cough, and set up a humidifier in your room to keep the air nice and moist while you sleep.
So here's the most crucial point of all. Be prepared. Please don't wait until you're already sick and feeling miserable to try and gather all these supplies. The final, and maybe the most important takeaway, is to build this respiratory first aid kit now. Have the zinc lozenges, the vitamin D3, C, quercetin, NAC, and all these other tools ready to go. Because that way, you can start this active support protocol within the first few hours of your symptoms, and that's when it makes the absolute biggest difference. Be sure to check the description for a link to the full resource article we use for this explainer. If you found this useful, please give the video a like. It really helps our channel grow so we can keep delivering these deep dives on important health matters. And of course, subscribe so you never miss another explainer.